A massive $4 trillion bill just passed the House that could change everything about your taxes, Social Security, and Medicare, but here's what politicians aren't telling you about who really wins and who loses. In the next 12 minutes, I'll break down exactly how Trump's one big beautiful bill affects your wallet, whether you're a senior citizen, working parent, or someone relying on government assistance. You'll discover the hidden cuts buried in this legislation and why some experts are calling this the most controversial financial overhaul in decades. Stick around because I'll reveal the one change that could cost Medicare recipients thousands of dollars annually, something that's being downplayed in mainstream coverage. Welcome to Financial Area, where we cut through political spin to give you the real financial facts that matter to your life. If you want more honest breakdowns of policies affecting your money, hit that like button and subscribe for weekly updates. Let's start with what might actually put more money in your pocket. If you're a senior citizen earning under $75,000 per year, this bill includes a brand new $4,000 standard tax deduction specifically designed for you. Think about what this means in real terms. If you're currently paying taxes on a fixed income from Social Security and retirement savings, this deduction could save you anywhere from $480 to $880 annually, depending on your tax bracket. But here's where it gets even better for some people. If you're married and filing jointly, that deduction doubles to $8,000. For a retired couple living on $60,000 per year, this could mean keeping an extra $1,000 to $1,700 in their pockets each tax season. That's not pocket change when you're dealing with rising healthcare costs and inflation eating into your fixed income. Now, the bill also makes the 2017 Trump tax cuts permanent. Remember those corporate tax rate reductions that were set to expire? They're now locked in permanently. But there's more. The bill introduces something that sounds almost too good to be true for service workers. Tips will no longer be taxed, and certain overtime pay will also be tax-free. If you're working in restaurants, bars, or any service industry where tips make up a significant portion of your income, this could be a game changer. However, let's address the elephant in the room that many people expected but didn't get. During the campaign, there were promises to completely eliminate taxes on Social Security benefits. That's not happening. Instead, there's a compromise, a deduction that reduces the tax burden on Social Security but doesn't eliminate it entirely. For many seniors, this feels like a watered-down version of what was promised, though it still provides some relief. Here's where the story takes a darker turn, and this is information that's being buried beneath all the tax cut headlines. The bill projects approximately $500 billion in cuts to Medicare over the coming years. Now, before you think this won't affect you because core benefits remain, let me explain what this really means for your healthcare. These cuts primarily target what's called provider reimbursements, basically how much the government pays doctors, hospitals, and healthcare facilities for treating Medicare patients. When reimbursements drop, healthcare providers have three choices: absorb the loss, reduce services, or shift costs to patients. Guess which option most choose? What this translates to in the real world is longer wait times for appointments, fewer doctors willing to accept Medicare patients, and higher out-of-pocket costs for services that used to be fully covered. If you're planning to rely on Medicare in the coming years, you might find yourself paying significantly more for the same level of care, or traveling further to find providers who still accept Medicare reimbursement rates. But Medicare isn't the only program facing the chopping block. The bill introduces new work requirements for Medicaid that could affect approximately 9 million Americans. If you're a childless adult receiving Medicaid, you'll now need to prove you're working at least 80 hours per month to maintain your coverage. On paper, this might sound reasonable. Able-bodied adults should work, right? But the reality is much more complicated. Many people receiving Medicaid live in areas with limited job opportunities, lack reliable transportation, or face other barriers to consistent employment. The 80-hour requirement doesn't account for seasonal work, gig economy jobs with fluctuating hours, or the reality that many low-wage jobs don't offer consistent schedules. What's particularly concerning is that this requirement comes at a time when many rural areas and economically disadvantaged communities are already struggling with limited healthcare access. Losing Medicaid coverage in these areas often means losing access to healthcare entirely, since these are typically the same communities with fewer private healthcare options. The changes don't stop there. SNAP benefits, commonly known as food stamps, are also facing significant overhauls. The bill expands work requirements to include parents of young children, a group that was previously exempt because caring for children was recognized as a full-time responsibility. Additionally, the bill shifts more of the administrative and financial burden to individual states. This means that states with tighter budgets or less political support for assistance programs might reduce benefits or tighten eligibility requirements even further. For families already struggling to put food on the table, this could mean the difference between having enough to eat and going hungry. The geographic inequality this creates is staggering. Families in states with robust social safety nets might continue receiving adequate support, while those in states with more restrictive policies could find themselves with significantly reduced assistance, even though their need is identical. Now let's talk about the $175 billion allocation for immigration and border enforcement, the largest single immigration spending increase in recent history. This money is earmarked for expanding detention facilities, hiring thousands of additional Border Patrol agents, and increasing deportation operations. From a purely financial perspective, this represents a massive shift in federal spending priorities. That $175 billion could fund significant infrastructure improvements, education programs, or healthcare initiatives. Instead, it's being directed toward enforcement activities that have historically shown mixed results in terms of cost effectiveness. The human cost is also worth considering. Expanded detention facilities mean more families separated, more asylum seekers held in federal custody for extended periods, and higher per-person costs for immigration enforcement. Current estimates suggest it costs taxpayers approximately $134 per day to detain each person in immigration facilities. Multiply that by the planned expansion, and you're looking at billions in ongoing operational costs beyond the initial investment. Perhaps one of the most concerning aspects of this bill from a constitutional perspective involves new limitations on federal courts. The legislation includes provisions that restrict federal judges' ability to enforce certain types of rulings, particularly those related to immigration and some civil rights cases. This might sound like dry legal procedure, but it has profound implications for how our government operates. Federal courts have traditionally served as a check on executive power. When the executive branch overreaches, courts can step in to enforce constitutional protections. These new limitations weaken that system of checks and balances. For ordinary citizens, this could mean less recourse when government actions violate constitutional rights. If a federal agency violates due process rights or discriminates against certain groups, the traditional legal remedies might be limited or unavailable entirely. Finally, let's address the $4 trillion debt ceiling increase that makes all of this possible. This is one of the largest debt ceiling increases in American history, and it's designed to prevent the government from defaulting on its obligations while funding all these new initiatives. Here's the financial reality. Raising the debt ceiling was probably necessary regardless of this bill's passage. The alternative, a government default, would have had catastrophic effects on the global economy, American credit ratings, and ordinary citizens' financial security. However, the size of this increase reflects the massive spending commitments being made. Critics argue this represents fiscal hypocrisy, promising tax cuts while simultaneously increasing spending and raising the debt ceiling by trillions. Supporters counter that the economic growth generated by tax cuts and the security provided by immigration enforcement will ultimately pay for themselves. The truth is probably somewhere in between, but what's certain is that this level of debt increase will have long-term consequences for future government spending, interest payments, and the financial obligations we're passing to the next generation. So what does all this mean for you personally? If you're a senior earning under $75,000, you'll likely see immediate tax relief. If you work in a service industry that relies on tips, your take-home pay could increase significantly. If you're planning to rely on Medicare, start budgeting for higher healthcare costs and potentially reduced access to providers. If you or someone you know depends on Medicaid or SNAP benefits, it's time to understand the new requirements and start planning for potential changes in coverage. The work requirements aren't just bureaucratic hurdles. They could mean the difference between having healthcare coverage and going without. The broader implications of this bill extend far beyond individual financial impacts. We're looking at a fundamental shift in how the federal government prioritizes spending, balances individual benefits against collective enforcement, and structures the relationship between different branches of government. What's clear is that this bill creates winners and losers, and those outcomes often fall along economic and geographic lines. Wealthy individuals and corporations benefit from permanent tax cuts, while low-income individuals face reduced access to safety net programs. Urban areas with diverse economies might adapt more easily to new work requirements, while rural areas with limited job opportunities could see residents lose critical benefits,